everybody. Happy Wellness Wednesday. It's November 10th, 2021. I'm Christine Pluta, Medical Director of Schuylkill Medical Associates, which is a concierge house call practice for seniors and the homebound. I service Philadelphia and Camden County. So welcome to my YouTube channel again. This is, I think, my third video. So tonight is just going to be a few pointers on home blood pressure monitoring, blood pressure cuffs, just a little bit of trivia. So a blood pressure cuff, the medical term is called a sphygmomanometer. And I had to look this up. Sphygmo is a Greek word that means beating of the heart or pulse. And manometer is a word that we use, something that means pressure, to measure pressure. So sphygmomanometer, that's your Jeopardy answer. If anybody likes Jeopardy, if they say, what's the medical term for a blood pressure cuff? It's called a sphygmomanometer. I don't use that term. But so in my daily home visits, I carry 4 different size blood pressure cuffs. And it's important to have all different sizes because patients come in many shapes and sizes. So there are the standard 4 sizes. There's an extra large. We have the standard size cuff. We have a small adult size cuff. And then what's called a pediatric cuff, which I have to use in patients who are extremely thin, often at the end of life when they've lost weight. So this is sometimes even too big for them as well. But this is the smallest that I carry. They do come smaller, obviously, for pediatric and neonatal. So yes, these are all interchangeable, and depending again on what size patient or what their body habitus is like will dictate which size cuff I use. Important thing is I try never to take a blood pressure over clothing. I do disinfect my cuffs in between patients, so rest assured, feel comfortable when I do pull up your sleeve and do it on your skin. Especially in the winter months when people are wearing heavy sweaters or layers, you really don't want to do the blood pressure over all of those layers of clothing. It just won't be as accurate. So sleeve up and cuff on the arm. You will often see me doing a wrist blood pressure. So when I do a wrist blood pressure, I will typically be using the smaller size. And I do that if I'm not able to get the cuff around the upper arms. Either it doesn't fit, or if somebody has contractures of their upper arms where I can't get the cuff in there, then I will go for the wrist. So oftentimes I have to be creative depending on how the patient is positioned in the hospital bed or in a wheelchair, but having all the different sizes really does help. In terms of home blood pressure monitoring, I think it's a great thing. I think anybody who has high blood pressure, especially if it's difficult to control, anybody who has heart disease, it is a great idea to have a blood pressure monitor in the home, and oftentimes your physician will ask you to have one. It does help us when a patient monitors their pressure in between visits. So there are a lot of different brands out there, and I'm maybe partial to one or two, but the most important thing is that it is accurate. And the best way to tell if it's accurate is to have your doctor check his or her pressure against your monitor. So if you're not homebound and you are seeing your doctor in the office, then take your machine to him or her and check it with the blood pressure that they're getting. I do the same in the home. So there are manual home blood pressure monitors, but I wouldn't recommend that for anybody unless you're a healthcare professional and know how to pump this up, and how high to pump it. Really, everybody should be getting a digital blood pressure monitor, whether it's for the upper arm or for the wrist. And both are fine. Again, the most important thing is to make sure that they are accurate by checking it against your doctor's blood pressure reading. The ones that go on the upper arm, you really do need to read the instructions or have your physician make sure you're using it properly. There's usually a red line or what's called the bladder of the cuff, and that is supposed to be right in the middle of the elbow, and then the cuff is wrapped around it. It should not be too tight or too loose. You should be able to fit one finger comfortably under the cuff. So again, if somebody really has a hard time with that, then the wrist cuffs are easy. You really just, they clamp onto the wrist and you hit go. Size can be an issue, however, so the digital cuffs come in really just one size, same with the wrist. If you find that the cuff is too big or too small, you would have to look online or wherever you purchased it from to see if you can get a smaller or larger size cuff. Same thing with the wrist. Digital blood pressure monitors can be found in any retail pharmacy, and I'm going to say they're about $60, but don't quote me on that. Again, it depends on the brand, and wrist cuffs are less expensive than the upper arm cuffs. And nowadays they come in all, fancy shapes and sizes. You can get them with Bluetooth capability where the readings can upload to your phone. And, some of them will take 3 consecutive readings instead of just one. They'll take 3 consecutives and average them out. So, I don't expect anybody to spend a ton of money on a home blood pressure cuff. But again, the most important thing is that I check it against my ears and the readings that I'm getting. So that's it for tonight. I like to keep it simple. I've got to go have dinner. I've got to feed the dog. I'm not sure what's on for next Wellness Wednesday, but I will see you on Monday with What's in the Doctor Bag Monday. That's on Instagram. My Wellness Wednesdays are on YouTube. So feel free to comment, follow me, send some likes my way, and that's it for tonight. So from my home to yours, have a great night. God bless. Bye-bye.